In the 1970s, two psychologists named Richard Nisbett and Timothy Wilson ran a series of experiments that produced a finding so uncomfortable that the field of psychology has been arguing about its implications for 50 years. They showed participants a documentary film. Then, they asked them why they had formed the opinions they had formed about it. The answers the participants gave were detailed, plausible, and internally consistent. They were also, in most cases, demonstrably wrong. The participants were explaining their opinions by referencing factors that the researchers had carefully controlled for, factors that had been held constant across conditions, and could not possibly have produced the variation in opinion the participants were attributing to them. The participants were not lying. They were not confused. They were doing something far more disorienting than either. Constructing a coherent, confident, completely post hoc explanation for mental processes they had not actually observed. They thought they knew why they thought what they thought. Nisbett and Wilson's conclusion, published in one of the most cited papers in psychology's history, was precise and difficult to absorb. People do not have direct access to the processes underlying their own mental states. What they have instead is a theory, a post hoc narrative, constructed after the mental event, using plausible explanations borrowed from their cultural environment, their prior beliefs about themselves, and their sense of what kind of person they are. The narrative is not fabricated. It is genuinely believed. That is precisely what makes it so consequential. The person who believes they know exactly why they made the decision, who believes they know their own values, their own motivations, their own character, is, the research suggests, in most cases working from a theory of themselves that is as much inference and construction as it is direct observation. And the more confidently they hold it, the less likely they are to examine it. Welcome to Dr. Cole's Dark Psychology. I'm Dr. Evan Cole, behavioral psychologist and behavioral analyst. Today, the most personal topic this channel has examined, not the psychology of someone else, not the narcissist, the gaslighter, the liar, the person running the interrogation, the psychology of the person watching this video, the specific, documented, neurologically grounded reasons why most people, including the most self-aware, the most reflective, the most committed to knowing themselves, carry a model of themselves that is systematically incomplete. The introspection illusion, the limits of self-knowledge, and the finding that changes how you use introspection once you understand what it actually is. Scene 03, definition anchor, a precise distinction before the neuroscience. Self-knowledge, as defined in the research, is the accurate understanding of one's own mental states, motivations, traits, and the processes that produce behavior. The research on its limits is not saying that self-knowledge is impossible. It is saying something more specific, that the primary method most people use to acquire self-knowledge, introspection, the direct examination of one's own thoughts and feelings, is less reliable than it feels from inside. Much of the mind is inaccessible to consciousness, including mental processes involved in perception, personality, attitudes, and self-esteem. Introspection cannot provide a direct pipeline to these processes. What it provides instead is a story about the processes, constructed from the content of conscious awareness, from cultural templates about what kind of person someone is, and from the motivated need to present a coherent self to the world. The story feels like direct observation. It is not. The mechanism begins with a basic architectural fact about the brain. The vast majority of neural processing happens below the level of conscious awareness. The prefrontal cortex, the seat of deliberate, reflective, narrative thought, sits at the top of a processing hierarchy that includes the limbic system, the basal ganglia, the amygdala, and a range of subcortical structures whose outputs influence behavior without ever surfacing into conscious experience. When the prefrontal cortex asks, "Why did I just do that?" it is not reading the output of those processes directly. It is observing the result of those processes, the behavior, the feeling, the decision, and working backward to construct an explanation. This is not a failure mode. It is the normal operation of a brain that runs most of its processing below the threshold of awareness, and whose conscious component has to account for its own outputs without access to the mechanism that produced them. The explanation produced is plausible, it is coherent, it is not reliably accurate. A precise distinction before the neuroscience. Self-knowledge, as defined in the research, is the accurate understanding of one's own mental states, motivations, traits, and the processes that produce behavior. The research on its limits is not saying that self-knowledge is impossible. It is saying something more specific, that the primary method most people use to acquire self-knowledge, introspection, the direct examination of one's own thoughts and feelings, is less reliable than it feels from inside. Much of the mind is inaccessible to consciousness, including mental processes involved in perception, personality, attitudes, and self-esteem. Introspection cannot provide a direct pipeline to these processes. What it provides instead is a story about the processes constructed from the content of conscious awareness, from cultural templates about what kind of person someone is, and from the motivated need to present a coherent self to the world. The story feels like direct observation. It is not. The specific name for what happens when the explanation is wrong but confidently held is confabulation. In clinical settings, confabulation is associated with specific neurological conditions. Patients who produce detailed, confident explanations for behaviors they cannot possibly have the memories to explain. But the research initiated by Nisbett and Wilson established that confabulation is not confined to neurological damage. It is a feature of ordinary conscious experience. The brain does not flag its explanations as uncertain when they are uncertain. It produces them with the same subjective quality of confidence, regardless of whether they are based on genuine introspective access or post hoc inference. The feeling of knowing why you did something is not evidence that you know why you did something. It is evidence that your brain has produced an explanation. Those two things feel identical from inside. They are not the same thing. The finding that most directly challenges the way people think about self-knowledge is this: introspection, the deliberate, focused attempt to examine one's own mental states, does not reliably improve self-knowledge. In some studies, it makes it worse. Participants who were asked to analyze their feelings in detail before making a decision were less satisfied with their decisions afterward than participants who had not analyzed them. People who spent more time thinking about why they felt what they felt were less accurate at predicting their own future behavior than people who thought less. The mechanism the researchers identified: introspection generates verbal, articulable explanations for feelings and preferences that are largely nonverbal and non-articulable in their origin. The verbal explanation then influences subsequent decisions, not because it is accurate, but because it is the most available representation of the preference. The person who thinks deeply about why they prefer one career over another, why they are drawn to one person rather than another, why they hold the values they hold, may be accumulating a richer story about themselves. They may also be drifting further from the actual processes that produce their behavior. Both are happening. The person usually only experiences the first. The introspection illusion has a specific and particularly well-documented consequence. People consistently rate themselves as less biased than other people. Not just slightly less biased. Substantially, reliably, across cultures and demographics, less biased than average, which is statistically impossible for most people to be simultaneously. The mechanism is precise. When a person introspects for bias, when they look inside for the influence of prejudice, motivated reasoning, or cognitive shortcuts, they do not find it. Not because it is not there, because the processes through which bias operates are not available to conscious inspection. The absence of introspective evidence for bias is then treated as evidence of the absence of bias. The person is not being dishonest. They looked. They didn't find it. The problem is that the looking and the not finding tell them nothing about whether it is there, because the place they are looking is not where it lives. The research has identified a counterintuitive finding about what does improve self-knowledge, not more introspection. Behavioral observation, looking at what you have actually done, not what you believe you would do, not what your theory of yourself predicts, but the record of your actual behavior across time and across situations. Observing your own behavior rather than introspecting putative causes may improve self-knowledge, because behavior is the output of the actual processes the brain is running, not the output of the story the conscious mind constructs about those processes. The pattern of decisions made under pressure, the pattern of who gets your real attention, the pattern of what you avoid, the pattern of when you find reasons not to do the thing you said mattered to you. These patterns are less flattering than the theory. They are also more accurate. The person whose behavior consistently contradicts their self-concept, who believes they are patient but acts impulsively, who believes they are generous but consistently prioritizes comfort, is not a hypocrite in the moral sense. They are carrying a theory of themselves that was built from introspection, and the theory is wrong. The behavior has been trying to correct it. They have not been reading the behavior. The research has one more counterintuitive finding worth examining carefully. In certain important dimensions, predicting behavior, assessing traits, identifying blind spots, other people are sometimes more accurate about you than you are about yourself. A stranger who has observed a person's behavior across several interactions carries a different kind of data than the person carries about themselves. The stranger has no access to the person's intentions, justifications, or internal narrative. They have only the behavior. And in the dimensions where behavior and narrative diverge, the stranger, reading only the behavior, is closer to the truth. This is not a comfortable finding. The person who knows themselves least well is often the person who has spent the most time thinking about themselves, because that time has been spent elaborating a narrative rather than reading the behavior that the narrative was built to explain away. The research on self-knowledge does not conclude that you cannot know yourself. It concludes something more specific and more actionable. The method most people use to know themselves, the direct, inward look, the careful examination of thoughts and feelings and motivations, provides a specific kind of information, a story about the self, constructed from the material available to consciousness, reflecting the person's beliefs about the kind of person they are. That story is not worthless. It is the narrative that makes the self coherent over time. It is how people maintain continuity of identity, organize memory, and communicate who they are to others, not direct access to the processes that produce the behavior that the story is in part designed to explain. The person who holds that story lightly, who reads their behavior alongside it, who takes seriously the feedback that contradicts the narrative rather than explaining it away, is doing something the research consistently identifies as rare and considerably more accurate than the alternative. If this changes how you hold what you think you know about yourself, that is the work this channel exists to do. Subscribe to Dr. Cole's Dark Psychology every week, the neuroscience underneath the behavior, the mechanism behind the pattern that makes no sense from outside it and feels certain from inside it. We'll see you in the next one.